Aaron Evans and the joint meeting of the COVID-19 Council Committee, along with Councilman Brandon Taylor and Health and Hospitals. To get us started today, we do have some information about vaccinations from Metro Health. And Councilman Taylor, do you happen to have the language around meeting virtually handy? Because that is one thing I do not have up on my screen.
I do not, but I know where to find it.
Oh, you know what? I just found it. Thank you for that. So let me go ahead and read the statement that pursuant to Governor Lee's Executive Order number 71 regarding electronic meetings, I make a motion that this committee meeting agenda constitutes essential business of the Metropolitan Council, and that meeting electronically is necessary to protect the health, safety, and welfare of Tennesseans in light of the COVID-19 outbreak.
Second.
Thank you for that. I do see several of our COVID-19 committee members, of course, Councilman Taylor, Councilwoman Courtney Johnston, and I do not see Councilman Pulley or O'Connell at this time. Councilman Taylor, did you want to recognize members of Health and Hospitals?
Thank you. Yes, we have our co-chair, Councilman Welch, and I believe that's it at this time. And I'd like to say hello to Councilmember Rutherford. Thanks for joining Councilmember Toombs as well.
All right, thank you very much. And I know that originally we had discussed, of course, we've got Dr. Gilwright here, and we were intending also to have Dr. Kai here today. I do not see that she is on the line at this time.
She's working on joining.
Oh, okay, perfect. So Councilman Taylor, we can go ahead and move on to Dr. Wright, if that will work, and then we can hear the information from Dr. Kai about the vaccinations that are available in the market to all of us, and really what the distinctions are. That was the area that she was going to be speaking on today. Does that work for you, Councilman Taylor?
That's perfect. Yeah.
All right.
To conserve some time, yeah, definitely. Thank you, Councilmember Evans, Chair Evans. Councilmember Evans reached out. We have been talking for quite some time in regards to having a discussion for vaccines and really COVID-19. And we have our Thursday morning meeting, and we rarely get a lot of time to kind of dive a little deeper into the conversations with the health department. And so we wanted to find some time, and we felt that this moment, when we do have our COVID-19 discussions, would be a great time to do so. And so she reached out and invited me to join as a committee member, as well as the Health and Hospitals and Social Services Chair. And so we've invited Dr. Wright and Mr. Tom Sharp to answer any questions from the council members, especially questions that you're receiving from your constituents on vaccinations, how to, where to, best practices, and what we're going to be looking toward to in the future. And so I would like to give the floor to Dr. Gilwright or Mr. Tom Sharp, just to share with us a little brief opening of where we are now and what we can plan to see in the future, and then we'll have some questions from council members.
Thank you, Councilman. I guess we'd talk a little bit about vaccine rollout and where it's at, and then I know Dr. Kai is trying to get on. I think she's actually going to come join Tom in his office. She's having a little issue. So, we report on a weekly basis, or have at the press conference. And we will be holding on Thursdays a small press conference. Dr. Jahangir and I, or one of us, will at least getting numbers out and such each week going forward. So that little piece of information for you. And I believe we're going to have continue to have council calls, I think, on a bi-weekly basis for the short term, and then look forward from there. Basically, I think the biggest thing to talk about is that currently just over 16% of all Davidson County individuals have been received at least one vaccine, and 9% are currently fully vaccinated. So we're getting there. It's a long ways to go. We did move into 1C on Tuesday. Sign up was began on Monday. We did well with that and didn't have any real problems as far as website or anything. And we scheduled in about 2.5 hours, about 11,000 appointments that go through the next 2 weeks. Along with that, as you may well have heard, we are going to do a super event using the Johnson & Johnson vaccine, which is a one-shot and you're done. On the 20th of this month at Nissan Stadium. That will be a drive-through. We will start at 6 a.m. and go through 7 p.m. We're expecting to try and do 10,000 doses that day. That's about 1.5% of the population we can get that done. So we have a number of organizations from FEMA to the National Guard, all of the health systems, a lot of the medical and nursing schools, pharmacy schools are all pitching in to help us with this. So that piece of information. We continue to work really hard to vaccinate our underserved and communities of color. We're working with Neighborhood Health. They are going to be going out. We've already given them some of the Johnson & Johnson vaccine so that they can go out and work with vaccinating homeless groups, encampments in particular. We today finished vaccinating for the second time Room at the Inn, men's and women's missions. This was started, we did this 3 weeks ago when we had a bunch of vaccine during the snow storm that needed to be used so it didn't go didn't expire. And we gave about 400 doses to those individuals. Additionally, we've got a mobile strike team that's going out and they've got a fairly full schedule over the next week. Well, actually through the 19th, so a little over a week. They've got over 1,800 scheduled. They're scheduled to do over 1,800 vaccinations out in the community. They are working with a number of the community organizations and churches, mosques, and others within the community to accomplish that. Finally, when we look at the numbers for 65 and older that have been done primarily at Music City Center, what we find is that of those eligible to receive the vaccine that are white, 44% of those have received the vaccine. 40% of those Hispanic that are eligible have received the vaccine, at least the first dose, and 33% of blacks that are eligible have received the vaccine. While these are not ideal numbers, I think that it does reflect a good start to getting communities of color involved and getting them vaccinated. And that's part of the reason that we're working so hard on the outreach into the communities also, is to increase that going forward. So we that's kind of an overview of where we're at. We're reporting new numbers. Those are from almost a week ago. So we'll be reporting new numbers tomorrow, as we usually do on Thursdays. So that's kind of an overview of what's going on with vaccinations. I should say Music City Center is currently scheduled to see 1,000 new doses a day. And if we've got vaccine to support them, is asking to increase that to about 1,200 a day. So we're working to be sure we've got enough vaccine, which I think we do. So we should be increasing that in the near future.
Great. Thanks, Dr. Wright. Councilmember O'Connell, I see you have your hand up already. Is that for a question?
Yeah, thank you, Mr. Chair. So thanks, Dr. Wright. I'm really encouraged by the progress we've seen. I can tell you from constituents and personal contacts, people broadly seem to be eager to get the vaccine as soon as they become eligible. And I've also heard very favorable reviews of the vaccination process itself. So thank you, first and foremost, to everything you've done with the Metro Public Health Department to get us set up to succeed from a public health standpoint. As you've kind of mentioned here, we've got several vaccine events and scenarios on the public health side. We know the private options out there, where people have established care, et cetera, are increasing. So I think, it won't be too much further into spring where we're starting to see the supply and demand pieces flip. Does MPHD have a process in place for kind of tracking vaccine hesitancy locally? Is there any sort of game plan for when we get to a point where, hey, maybe we hit a threshold where 65% or so of 16 and up general population Nashvillians have been vaccinated, but there is a remaining percentage who, even with that, are still reluctant to get vaccinated. Is that being tracked, and do we have kind of a plan for what to do at that point?
Yes, it is. It's being tracked on. There are various reasons for hesitancy, both, if you will, right-wing, left-wing reasons for it. And we are tracking that and trying to work on social media and all of those types of things to encourage it. The biggest thing that we found is that having somebody get vaccinated and see that they don't have a problem encourages people. We see an uptake. So we go clear back to when we had our first responders. A number of them got vaccinated, but a number of them were hesitant. They didn't get vaccinated. But when we came back for second round, for their second dose, we picked up almost 600 individuals that wanted to get their first dose at that point. And we're finding that consistently throughout any community. We're finding in the Black community, I've had several anecdotal reports that a couple of people within a church said, I'm not getting it till the preacher gets it, or some leader they know. So that is, but once they see that, a lot of them are changing their mind and going ahead and getting vaccinated. So it's encouraging. Based on our current rate, and we're giving a number of the vaccines, but you also have to remember that all the hospital systems, Walmart, all sorts of different places, Kroger's are giving vaccines soon. CVS and Walgreens will have it. We're thinking that at this current rate, we may be at 40% vaccinated as early as the 1st of July, which would be great. That really allows us to start to really look at how can we start to, open up and allow more activities within the community, because we'll feel safe in doing that. So working on that piece. But the biggest thing is as you would expect, if your friend gets it and you say they do okay and they tell you they do okay, you're more likely to get it. So every chance we can, we try and encourage people to talk to others they know after they've had that experience to try and help encourage it. But yes, we continue to track and follow that.
Great. Thank you for that. That's very helpful. I think a related topic that I'm kind of interested in MPHD's take on is, as we now have started to see the Johnson & Johnson vaccine arrive, and now we have, multiple vaccines that require different dosing regimens, I think it obviously increases the complexity. So I guess a couple of related questions there. Right now, and I'm not in any of the eligibility categories, so I have not looked at the appointment process, but does MPHD indicate at time of appointment or, in some other way to a potential recipient which vaccine is being offered at which site? Is that something that is kind of known in advance?
Yeah, we're trying to be very specific about which ones we are providing.
Okay.
I mean, obviously, mainly we're providing Pfizer at Music City Center, and that's actually all we're providing there. We do have a few people that have had Moderna that need follow-ups, so came from out of town in, whatever. So we're going to offer some small clinics here where we can get enough people. 10 is the number we want to try and have so that we can open a vial, use it, not have any waste. But we're not using a lot of Moderna. That's being used more out in the community, particularly by the federally qualified health centers, because it's easier to handle. And then with the Johnson & Johnson, we were very specific about our event that's going on at Nissan, that's what we're doing. We are seeing a little bit of vaccine shopping, if you will. And so we do need to make that available. There also is some hesitancy by certain groups about getting certain vaccines, in particular Johnson & Johnson's, because of an original fetal cell line issue, but even the Pope has said, you can get it, it's not an issue. So I think that will solve that. But yeah, for whatever reason, people have thoughts on what they want to get. I think when Dr. Shakai is able to talk about, there may be different reasons that certain individuals should make some decision on which one they get. But right now, yes, we're trying to be very clear, because we want that good experience that so far has been happening with our sites, that, you know, they come, they're happy with what the interaction, and that would really throw a problem into things if they were showing up and then not, and told they can't get what they thought they wanted.
No, that's extremely helpful, and I want to commend you all on the transparency, because I think, you know, especially as we see supply increase, I'm perfectly, you know, on a shots in arms basis, I'm happy for people to get whatever vaccine they prefer. I guess a quick related follow-up, and then I'll be done, is, so, you know, I think the other part of this, when I mentioned the complexity, is, right, my guess is that we will see some people who, for whatever reason, get Pfizer or Moderna and get that first dose, and then maybe, you know, concerns increase, interest falls off, you know, risk analysis changes, whatever. Are we kind of tracking time to second dose? And similarly, in terms of accessibility, are we working with vulnerable populations to ensure that they can access a second dose?
Yeah, we're doing both of those. We actually, if people are not showing up for their second dose by about a week after they were supposed to get it, we're trying to call them and encourage them, find out why. A lot of them, they've moved, they're in the hospital, they're sick, you know, they've traveled. So we're still seeing pretty good numbers as far as getting that second dose. But yeah, we've got to continue to follow that and such. And we want to make sure that we're routinely scheduling to go back into communities to give that second dose when we go out. So 3 weeks later, we're going to have that in that same spot, same times, having people come to that same place so that they can get their second dose.
Great. Thank you so much. Thank you, Dr.
Anybody
Wright.
that doesn't get a second dose can always show up at Music City Center. They just have to have their card. We will give it to them.
Got it. That is extremely helpful to know. Thank you. And thank you, Mr. Chair. That's all I've got.
Thank you, Councilmember Henderson.
Thank you, Chair. Dr. Wright, I echo what Councilman O'Connell has said as far as my feedback from my constituents, and I've expressed in previous council calls that I really appreciate kind of the evolution in social media and online, how y'all are being a little bit better in your kind of detailed information that you're providing, and also your follow-up to folks when they have questions, like actually responding to them on Twitter and on Facebook. What I'm not seeing as much of, though, is you can see some patterns to the questions. It surprises me the extent to which people ask if diabetes is a chronic renal disease. And so I'm wanting to suggest, like, when you see those questions, have that inform kind of the art and the graphics that you use. Like, you know, so while some of your things are saying, like, oh, these 5 different things fall under this category of qualification, you know, make sure that under chronic renal disease, it says explicitly diabetes, you know, because obviously somebody who has that, but, you know, maybe it's their grandchild that's going online to schedule for them, or that's kind of doing the scheduling piece for them, and they may not be as keenly aware, like, oh, I know grandma has diabetes, but maybe I don't know that that's a chronic renal disease. I mean, so that's one thing that I'm just, I want to commend you all for the heightened level of engagement, but sometimes I don't see it inform. Like, it makes me think about how when I post something, what I add and I share, and then I'm always hoping the next time y'all come and repost, you will kind of update it a little bit with a little more, but then I find you just sort of default to the same graphic. You don't really change the information.
Well, I want to correct a little bit, because chronic renal disease can be because of diabetes, or it can be completely separate. So
okay.
It is not, diabetes isn't a condition that's caused by the chronic renal disease. It's the other way around. And each is an individual risk factor. So I can have chronic renal disease, or I can have diabetes. Either one's a risk condition. Either one is going to get you in the door to get vaccinated. So
okay.
All they need to know is that they've got one of those.
Okay.
I will talk about that with our social media people, but yeah.
I appreciate that. Diabetes is never listed explicitly anywhere that I can find.
Okay. I'll look at what's out, because that's definitely one of the risk factors.
Okay,
Council Lady, I'm sorry, if I could just chime in. This is Dr. Joanna Shaw-Kai, and I've helped register a few people on there. So diabetes is listed as one of the options, but we will, as Dr. Wright said, look into that and make sure it's clear.
I appreciate that. Yeah, and again, I'm just talking about social media presence, what, I'm mindful of and I can find. I'm not saying that if you go to COVID-19 or you go down and you can't find it in a list somewhere, but I just think because that's a chronic condition that so many in our community have, just being more explicit to say, diabetes is one of those. No doubt when they engage with you all, they're well informed and, y'all are doing that. I'm speaking particular to social media. Thank you.
Thank you, Councilmember Henderson. Do you have any additional questions? Thank you.
No, sir.
So I have a quick question. So Dr. Wright, one of the questions I received is, I guess, more opportunities for individuals and constituents to receive vaccines outside of the downtown area. Do we have any thoughts on opening up vaccines further out into the Davidson County communities? With not necessarily with the Walgreens or the Walmart avenues, but something that we're going to spearhead the further spaces and outreach in further spaces in Davidson County.
Yeah, there are a number of things that we're looking at. I mean, that's what we've got our mobile team doing, is to go out and go to, churches and that type of thing. We are looking at potentially converting our Kmart testing site to an actual vaccination site over the next 3-4 weeks. It's driven a little bit by, again, being sure we've got enough vaccine and that we've thought through the process. But right now, everything's being focused on the 20th because it's such a major event. But then as soon as we get past that, we'll have good experience going through a drive-through process. So we should be able to do that fairly quickly. We have had initial discussions with Meharry, who's been staffing that site for us as a testing site, and they're very excited to convert over to vaccination. So that will probably be coming in the near future.
Thank you. Councilmember Evans.
Thank you, and thank you, Dr. Wright and Dr. Shaw-Kai for being here today. I guess I wanted to go back to, first of all, just Dr. Wright, your previous question or comment about converting the old Kmart on Murfreesboro Road. Is that right now the area where you're starting to see testing diminish most significantly?
We're seeing testing diminish significantly across the board, but it's always been one of the lowest areas for testing, and we continue to look at that. But that appears to be the area that has one of the lowest testing. The other thing that's convenient about it is it has a lot of space to be able to park cars after they've been given the shot for the 15-minute wait. So it appears to be a good location to to start that with. Meharry, unfortunately, is on the street. That makes it a little hard to park cars for the 15 minutes. And there is definitely not enough space at Nissan in that particular parking lot. So then that would mean picking up and moving everything. So that's kind of why we're investigating, at least giving it a try. Plus, it is in an area that is has a higher population of Hispanic and other communities of color. So with that, when we look at that, we've already had a discussion also about potentially having a little different hours so that it's either earlier or later, because it allowed people to do it before or after work. So.
Makes sense. And so with the testing sites, like I noticed this week on the social media post about that the hours were going to be from 10 to 3 at the different locations. And so will we start to then see a shift of, hey, we're going to potentially convert this Kmart site, and then the hours at the other sites will remain the same, and start to see some shift on those hours at the other two sites?
Yeah, we like to try and keep our testing site hours pretty steady if we can. You know, because of the weather and stuff, we had changed it for the time being. But with vaccination, especially as we get into spring and then into the summer, we're going to want to have those probably earlier or later just because of the heat and everything else. Plus, we're looking at the other thing that's happening, of course, this weekend is the time change. So that'll also have a little effect on what we decide.
Yeah.
Can I make a suggestion that we let Joanna give her presentation and then let people ask questions to whichever of us? I'm going to stay on, but that way you'll also have that background to be able to have questions to ask.
Yes. Can I ask? I have one more question, and then I think that's a great idea. On the mobile teams that go out, is there how do we request, like if we have a church or we have a identified community group that really could spearhead that? Do we just need to email in to you and Mr. Sharp, or what's the best way?
That would be perfectly fine.
Okay.
You know, we'll get it to the team. It actually would go to Leslie Waller's actually moved kind of into that, helping with that.
Okay, great. Thank you very much. And Councilman Taylor, I have no other questions. Thank you.
No, thank you. Yes, that'd be great, Dr. Well, I don't see many other hands up. I put my hand up. I try to put my hand up just to get in line to get some things cleared. Councilmember Bradford has had his hand up for quite a while, and I don't see any afterwards. Councilmember Bradford, would you like to go ahead and ask your question? And then we'll go into, then immediately following Councilman Bradford, we'll go into the presentations. If any other questions arise from there, Dr. Wright has shared that he'll stay on. And of course, I know that we have a presentation for the COVID-19 committee as well. So Councilmember Bradford.
Thank you, Councilmember Taylor, for recognizing me, even though I'm not at either of these committees. I have a question as relates to the swapping over from the testing at the Kmart Center to vaccination. Are we confident that, my concern is once we take away the testing site and switch to vaccination, then it's going to make it, people who may utilize that for their testing will not have to go somewhere else. So is there a certain confidence level there that we don't need to rely as heavily on the testing and just get people vaccinated?
Yes, I think that at this point, you know, especially with the significant fall in the number of cases, and because of that also a real fall in the number of people being tested, I think right now is the perfect time to try and get as many people as we can get vaccinated before we potentially start to get maybe some of the variants that are causing increases and such. Because the more people we can get vaccinated, the better protected we are, the better off we're going to be in the long run. So that's all going into it, but also just because it really is only, I think it's only about maybe it's less than 200 tests a day. So really very low, and maybe not the best use of the resources that we've got.
Okay, I appreciate that answer.
Sure.
Thank you.
And we'll
Councilman
continue to have Nissan open to be able to do testing. So it may be an inconvenience to travel, but if they really are concerned and want to be tested and don't want to pay for it, it'll be available.
Thank you, Councilman Bradford, Dr. Wright. Ms. Gilchrist, could you please, there's an attendee on the phone, Councilmember Benedict. If you could please add her as a panelist. She does have a question, but as we mentioned earlier, I want to go ahead and get into the presentation, and Councilmember Benedict will get you added into the panelist so we can get your question. Dr. Wright, back to you all.
I'm sorry. Unfortunately, I can't make her a panelist. I think she joined the meeting as an attendee. But Ms. Benedict, I did unmute your mic, so you have full control over your mute and unmute options.
Thank you so much.
No problem.
Thank you. Councilmember Taylor, did you want me to go ahead or go into the presentation first?
Let's go into the presentation, if that works for you.
Thank you. Thank you.
All right, thank you. Dr. Shawkai, we appreciate your time and thank you for joining us to talk about the different vaccine types and sharing your experience about how they were developed. So we appreciate it.
Okay. Thank you for inviting me to speak, council members. I'll be able to share my screen.
Kenya, Dr. Shawkai has a presentation to share, and so if you can give her the permissions to be able to share her screen.
Madam Chairman, this is Tom Sharp. I logged Joanna into another computer, so she would need to give that to me. I think it thinks that's me in there.
Oh, okay, great. Thank you.
Okay. Oh yeah, I do see my name is Tom Sharp.
I am much older.
So Tom, do you operate it from your office or do I?
So which person is needing to share the screen?
Okay, let me see if I can share. Okay. Oh, I don't know what that is. Security alert add-ins. Tom, are you able to click in, or is that me? Let me see. Okay, there we go. All right. Okay, so thanks again, council members, for your time. My understanding was that you wanted to hear a little bit about the COVID-19 vaccines and their efficacy, and also concerns about safety, and to do that all in 15 minutes. So there definitely will be some information that will be left out, just to be mindful of time. So don't hesitate to ask questions. As we start, we'll start with some just general definitions, because we hear people interchange COVID-19 and SARS-CoV-2. The SARS-CoV-2 stands for Severe Acute Respiratory Syndrome coronavirus. Is one of the few coronaviruses that infect humans. And there's one strain of it. And as you've heard, and also Dr. Wright had mentioned, there are various variants of it. So these viruses are a bit unstable, and they will change a little bit of their genetic material, and that results in different strains. That results in different variants. The strain remains the same in that the disease manifestation is the same, and there's not much different in that from that mutation for it to then become a different strain. So as you've heard about the UK variant and the Brazilian variant, just with those changes in the mutations, in the strain, those mutations can make the virus a little bit more contagious. And now, it's with the UK and others more, the possibility of causing more severe disease. And the SARS-CoV-2 virus is what causes COVID-19 disease. And COVID-19 stands for coronavirus disease and started in 2019. So in a couple of other terms that we hear that interchanged a bit, efficacy and efficiency. Efficacy is usually when the vaccine is being tested in the clinical trials, and then when the vaccine is produced and out in real life, and we look to see what that efficiency is now that it's being given to the population. And you are aware, as far as the symptoms of COVID-19, mild symptoms is what most people will have, and they just feel well. They may have fever, headache, cough, when you hear about the loss of taste or smell, and they have no difficulty breathing. When we move on to moderate illness, these patients definitely don't feel well. They'll have some shortness of breath. They cannot carry on a conversation like I am right now. And then severe illness, those people are medically unstable, and severe illness can lead to death. But the good thing is that most people will have mild illness, and that's about 80% of people. So the FDA early on set a criteria for emergency use authorization, or EUA, as you hear a lot. And they said that for those manufacturers of COVID-19 vaccine, they must show that the vaccine is at least 50% effective compared to placebo. And it must be a well-designed clinical study. And they must show that the vaccine is safe, and there has to be efficacy data. So in the clinical trials, they have to show that there is an effect, there's a response from the vaccine. And all through the FDA is involved, and also a data safety monitoring board is involved. The other criteria for the manufacturers is that the manufacturers had to agree to follow those who participated in the study for more than 1 year. So you hear most of the studies being at least 2 years. And then also the manufacturers had to approve to have a post-approval safety monitoring plan. So a question we get asked a lot, and you all probably do too, is which one of the vaccines is best, and is one better than the other? And at this time, no, we cannot say that one is better than the other, and that's because there's been no head-to-head studies comparing the vaccines. The vaccines were studied in different locations at different times, and so we cannot say one is better than the other. And the group we look to, the Advisory Council on Immunization Practices, the ACIP, who also weigh in on approving the vaccine, have also said they have no preference regarding the 3 vaccines that are now approved, the Johnson & Johnson or Janssen, the Pfizer, or the Moderna. So as far as the Pfizer BioNTech vaccine, when we look at the phase 3 studies that had thousands of people, that was done last year, September to November 2020. And it was tested on those age 16 and older. And you can see the countries included the US, Brazil, Argentina, South Africa. And these were times when we were not so concerned about variants. There hadn't been, the virus was not mutating much. And you can see that, so let me try to get my pointer. So I think because Tom and I might be sharing, I'm not able to control the pointer here. But let's see. Okay. You can see that in the those people who received the COVID-19 vaccine, 8 of them, excuse me, developed COVID-19, and most of those were mild symptoms, as opposed to 162 who did not get the vaccine. And that is where the 95% efficacy comes in. Am I? Yeah, I can't see anyone. Okay. Sorry about that. Can you all hear me?
Yes, we can hear you fine.
Okay. Okay. Sorry, Tom was just checking. Okay. And the good news about the Pfizer vaccine is that in those who received the vaccine, there were 0 hospitalizations and 0 deaths. In those who did not receive the vaccine, there were 5 hospitalizations. And in that group, there were no deaths. When we move on to the Moderna vaccine, again, that was done September through November. This one was age 18 years and older, only in the US. And for those who received the vaccine, only 11 out of 14,000 people developed symptomatic COVID, excuse me, and as opposed to 185 who did not receive the vaccine. And that's where their 94% efficacy of the vaccine comes from. And as far as hospitalizations, you can see only 1 person who received the vaccine required hospitalization, as opposed to 9 who did not receive the vaccine. And then the deaths were 0 in those who received the vaccine and 1 in the group that did not. And again, showing that for most cases, the COVID-19 disease is mild, but of course, as we know, deaths do occur. When we look at the newest one, the Janssen, and the reason we said that we cannot compare head to head, you'll see that their testing, their study date was from November to January 2021. And, you know, by then we're hearing all about the variants in the UK and South Africa and Brazil, excuse me. And their studies were done in US, South Africa, Brazil, Chile, Colombia, Peru, and Argentina. You can see that with their vaccine, 173 people out of 19,000 had symptomatic COVID, as opposed to 509 out of 19,500. And their efficacy was 66%, as opposed to 72% in the US. And that's because in the US we had less variants. Hospitalization was only 2 people and 29. Thank you. Excuse me. It's allergies time. And 29 of those who did not get the vaccine ended up having to be hospitalized. So we can see that for severe disease that the vaccine is quite effective. As far as deaths, during this period, we know that was a peak time for deaths around the world. There were 0 in those who received the Janssen vaccine and 7 in those who did not. So we had a town hall the other day, and there was a concern about deaths. Well, and people say, well, I heard that deaths occurred in those who received the vaccine. And just so you know, in the US, when I was looking up information for this talk, every 11 seconds, I believe they say someone dies. And with these vaccines, even if the person dies and is not related to the vaccine, it is still recorded. What the CDC and others that study this data closely are saying that yes, deaths have occurred in those who received the vaccine, but as of now, it does not appear that these deaths are related to the vaccine. And when it compared the number of people who received the COVID-19 vaccine and have died compared to those who received, compared to the normal rate of death in the US, there is no difference. That is, those who receive the COVID-19 vaccine are not experiencing a higher rate of death than those who have not received the vaccine. One thing that's interesting, and it's a good thing, is that they noticed, though, in people who were vaccinated in the nursing homes, it appeared they experienced a lower number of deaths in those who are vaccinated. So listening to a talk the other day, one of the experts from CDC said, could it be that maybe those who are healthier are the ones receiving the vaccines? I would like to think that is that the vaccine does have protection, as the studies have shown. And so, and just to repeat, there were no excess deaths that were seen in those who received the vaccines. So when we look overall at the vaccine studies that were done, overall with the 3 vaccines, the efficacy was 89% or greater to prevent hospitalization, and no vaccinated person died due to COVID during the studies. So that is very good. That's what we're trying to aim for. We'll switch topics a little bit to look at why do people remain hesitant. And on the CDC website, they post a study done by the Kaiser Foundation that shows that most of the people who say, I'm going to wait and see what happens, I'll wait and see what happens when my friend or my cousin take it, a family member takes it, is that because they're concerned about side effects. And that's a question we get asked a lot also. We can see that these vaccines are highly regulated and highly monitored, including the vaccine side effects. You can see the list of different databases and ways of documenting and recording vaccine adverse events that have occurred, excuse me, even those events that have occurred in those who are vaccinated that might not be related to the vaccine are also recorded. Because one of the things is people say, well, how could they have manufactured these vaccines so quickly when it takes years? And usually it takes the vaccine manufacturers years because they're gathering money and that is not their number one concern at the time. But you know, with the COVID-19 pandemic, it was all hands on deck at these manufacturers, and they were able to sometimes do more than one thing at a time instead of slowly over time. So, and I can tell you that with the VSafe checker, that's one that when someone gets their vaccine, for those of you who have been vaccinated, you should have received information on VSafe. I can tell you I'm enrolled in it and it's quite easy. And I think now like once a week, you'll get an alert that says, hey, it's time to check in and see how you're doing. And that's just the CDC way of gathering data. Most commonly adverse events after vaccination with the Pfizer vaccine were headaches, fatigue, and those that you've heard of. For the sake of time, I won't run all through it, but just people might not feel, might have some discomfort, some side effect of just that pain in the arm, but most commonly was the headache, even with the Moderna. And with Janssen in their clinical trials, and of course, if we were to give this talk again, then we'll have, after it has been on the market, what people are reporting. But it was the same. And as far as anaphylaxis, you can see it's very rare. In the Pfizer vaccine, there were 4.7 cases out of 1 million doses that had anaphylaxis, in which the person just, stops breathing. And so that's a very rare reaction. It's not advised that vaccines be interchanged. And I think might be out of time. So I'm going to skip to the conclusion, which is important to get vaccinated. The vaccines are safe and effective. The most common side effects are mild and tolerable. Anaphylaxis is rare. It appears safe for pregnant women and infants, and the CDC and the immunization experts encourage women who are pregnant to get vaccinated. We cannot say one vaccine is better than the other. And also getting vaccinated will help stop the development of variants and stop the spread of variants. And while this pandemic is evolving, continue to wear masks, physically distance, and hand hygiene. And I know there are some updates that came from the CDC. I believe it was yesterday or the day before, but for the sake of time, I won't get into that. So thank you.
All right, thank you. I have a question, so I'll go ahead and I raised my hand out of habit, but on the 3 different types of vaccines, been hearing some about boosters being in development, or that could be forthcoming. And so have you heard any of the latest information about what that might look like? And, what would that be something that would happen 6 or 8 months from now after people get vaccinated, or could it take longer than that?
The talk about boosters are going on, and might be something that's done annually, is what we're hearing. So looking at the, especially for the 2-dose vaccines, probably in the fall or so, may have to get a booster. I think there was talk of Pfizer maybe sooner than the fall. But definitely by the fall, we might need a booster, just to take into account those other, the current variants. There are also some preliminary studies from Pfizer and Moderna saying that their current vaccines are quite effective against the variants. But those have to be verified by the experts, the CDC and others.
Very good. Thank you for that clarification. I'm taking a look, and I know Councilman Taylor had mentioned that Councilwoman Benedict had a question. I don't see any other hands currently, so Councilwoman Benedict, I can recognize you. Councilwoman Benedict, are you on the line?
She is on mute.
Okay, I don't see her, so we can recognize Councilwoman Jenny Welsh.
Thank you, Madam Chair. I have a question that Dr. Kaka may not actually have the answer to, but I just wonder, is it a possibility that they could possibly put COVID vaccine boosters, pair them with flu shots? So going forward, we could get people vaccinated for both of these things at the same time and help both of these illnesses get tamped down?
I think definitely that is a possibility because the COVID-19 vaccines are all inactivated. Right now, they're recommending separating the vaccines by 14 days from others just because it's new. But there should be no reason why they cannot be given with other vaccines that are inactivated.
Thank you.
One question that I have, I'm personally getting the Johnson & Johnson one tomorrow night is my appointment. And so kind of going back to the efficacy and the efficiency pieces that you were sharing with us, I guess, has there been, I guess a question that I have is, would there be harm of, getting the Johnson & Johnson and then, 8 months later, I'm like, I think I need the Pfizer. I mean, what is to dissuade people from doing those kinds of things and trying to layer vaccines on top of each other?
Well, I think 8 months from now, maybe that won't be irrational thought. It might be something that people do. For now, the recommendation is not to interchange the two different vaccines if you're getting the first and the second dose of the two. But for whatever reason, if someone got the first dose of a vaccine, the Pfizer, the Moderna, and could not get that second dose, they could get the Johnson & Johnson to complete their series. But, 8 months from now, it might be a different landscape, and that just might be an option.
I'll let my husband know that my, logic is not totally irrational on that. So thank you for providing some good dinner conversation later. Councilwoman Welsh, I see your hand is raised. Is that an old hand or you have a new question?
I actually do have a new question. My entire family was very lucky to have been vaccinated about a week ago at a first come, first serve event at a Walmart in Smithville, Tennessee. And they have us scheduled to come back for a second vaccine less than the recommended 28 days. It was the Moderna vaccine. And I'm wondering, is that something that is a problem, going back less than the recommended 28 days?
Well, I guess it depends on how early it is. There are plus or minus a few days. I think it's maybe 2 or 3 days, but it's really recommended that if you don't, if you can wait that 28 days or later to do that. But we have to, I don't know if Dr. Wright knows offhand, but like for the Moderna, I think it's maybe plus or minus 2 or 3 days.
Well, I know my son is 4 days early and we are 3 days early. So
yeah, probably you could, I would recommend waiting and going back, at 28 days or later, say, oops.
Oops, we couldn't make it. Thank you.
There is some early data that says waiting longer is better than getting early.
That is true. There's even the talk of 6 weeks, but yes. So yeah, I would ask him if you
then I am
could
happy
have
to
that
come to any
appointment.
event in Nashville you'd like to give everyone the second dose.
All right, thank you. It looks like Councilwoman Benedict dropped off, and so we will move on past her. It does not appear that anyone else has their hands raised for any questions. So Councilman Taylor, I don't know if you have anything else that you would like to conclude with our conversation today, since I know we've kept Dr. Wright and Dr. Shaw-Kai-Kai a long time, and we appreciate their time very much.
Thank you, Chair. Yes, we truly appreciated your time today and your willingness to to visit with us. I have nothing. Just to let you know, thank you, Chair, for inviting our committee to join you all today and ask some questions and get some questions answered. As we move forward, of course, we'll be in touch with each other, Health and Hospitals Committee and COVID-19 Committee. I have a pleasure of sitting on both of those committees. For our colleagues, if you have any questions that you want to ask, I'm sure I'm going to just say send them directly to Mr. Sharp or Dr. Wright. I don't know if I'm speaking out of turn, but I'm sure they'll be able to answer your questions. They've been very good across the last couple of months, just getting back with me, and I'm sure they'll do the same for you.
All right, thank you very much. Well, Dr. Shaw Kai and Dr. Wright, thank you so much for joining us today. Since there's no further questions, we can consider this meeting adjourned. Thank you.
Thank you.
Thank you, Chair.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.